Here.
Aside from not returning to play, what else should an athlete do in the hours after a concussion to improve their healing?
Good question. I'll say one word: nothing.
Can you just repeat it for?
The question is, what should an athlete do in the hours after a concussion? But Bob, I'll let you do the real medical discussion.
Well, that's really it. Physical and cognitive rest are important. You've got cells that are damaged, cells that will recover in almost every case. If you rest them, if you subject them to physical exertion, if you subject them to cognitive exertion, you may tip them over and either prolong the time that they're not working right and therefore symptoms are occurring, or actually tip them over and in some cases cause them to die. So the important thing is, while symptomatic, an athlete should have physical and cognitive rest.
And let me add, in part of our training, we talk about a young man named Austin Trenum. And this is a story that went public in August, where Austin was a high school football player in Virginia who got a concussion on a Friday night, and his family thought they did everything right, and they sent him to the emergency room. Emergency room doctors were not up to speed on the latest guidelines and things to tell parents, and so all they said was, he should be fine, it's a minor concussion, bring him back in a week and we'll evaluate him. They did not say shut him down cognitively and keep an eye on him. And so what Austin did was, on Saturday night, he went to a rock concert with his girlfriend for 5 hours, very loud, lots of light, strobe light stimulation, terrible thing. Next morning, woke up, played video games that was out of character for him, and played a marathon video game. And then he had not been studying, and he was a 3.8 GPA, and his parents wanted him not to do a senior slack off, and so they talked to him. They said, you got to get up to your room and do your homework. They had an argument with him. And because Austin's brain was not functioning normally, his choice to react to that was to go upstairs and hang himself. And he died, and his brain came to our brain bank, and Dr. McKee found that he was actually suffering from multifocal axonal injury. So his axons were actually not functioning. They were impaired, they were damaged, and they were damaged in the area of impulse control. And so Austin was, frankly, just not the same guy that he was 2 days prior. His brain was not functioning normally. So had that not happened, he would not have killed himself. That's something you'd be pretty sure of. And the problem was the parents didn't know to keep an eye on him. And so that's now a major talking point with athletes and parents is people are going to act out of character after concussion. They're going to, if you don't watch them, you're talking about, they should not be driving a car. They should not be wandering around town. People get in fights. People get out of character. People steal things. I mean, you can imagine what you do if you're out of your mind. And so it's just not something that we've paid attention to. And since that article went public, we've now gotten calls by a lot of families who've had children die or kill themselves within 48 hours of concussion. And so we're trying to, this is a new area that we're piecing together.
So is it do nothing for hours or for days or weeks?
The ratcheting back on the physical activity to no more than walking, nothing that drives your blood pressure up. The ratcheting back on the cognitive activity, which is something the doctor determines just what level that is while somebody is symptomatic. And it depends on the degree of symptoms, and the more symptomatic they are, the more you have to ratchet back. Even when you do all of those things, in not every situation do things diminish. In our own personal experience, although it involves many thousands of patients, we've had some instances where individuals with post-concussion symptoms, both of these cases I'm thinking about right now are young ladies, but we also have a BU hockey player that did attempt suicide. Both these young ladies required acute hospitalization to psychiatric institutions for depression and panic attacks and just incipient, perhaps, suicidal ideation. We don't really know how often that happens, but we do know that it does happen.
Another yes, here.
Yeah, the old days used to be take the individual that did go to the hospital and get a head check sheet that said, we'll wake you up every 2 hours, and if we have trouble waking you up, bring them back to the hospital to be checked out. Probably about 15, 20 years ago, all that changed because a lot of those people were getting admitted, and nowadays it's much more cost effective to just do a head CT and send the patient home in terms of saving money in the healthcare system. If the head CT is done and a head CT is negative, the patient shouldn't be awakened every 2 hours, because you're only going to sleep deprive them, worsen their concussion symptoms most probably. So these individuals need to be followed by the parents with a head check sheet, but that check sheet doesn't have to be wake them up every 2 hours. It's just if the symptoms get worse, if there's any difficulty with headache, nausea, vomiting that's increasing, any of the symptoms worsening, any diminution in level of consciousness, alertness, feeling spacey, feeling in a fog, bring them back for further evaluation. But that waking up every 2 hours is gone by the boards.
Yes.
Dr. Cantor, you mentioned at the very beginning of your talk that science is kind of creeping behind awareness levels. And I was wondering, you mentioned a little bit about going more into what is actually going on, what can we see inside the brain, what would be the next studies that you would like to see?
Well, I think a lot of prospective studies need to be done, and I think what's going on at BU will be very interesting in terms of whether we can make the diagnosis of chronic traumatic encephalopathy in a living individual. That's the whole purpose of longitudinally following this high-risk group, comparing them with a low-risk group that's not had any recognized head trauma throughout their life, and seeing what are the biomarkers that we're going to be following, what are the imaging studies that we're going to be using will allow us to make this diagnosis in a living individual. Obviously, they're going to have to die for us to prove whether they had CTE or not, so it's probably going to be decades before we have our final answers. I think those studies are important. I think it's also very, very important that there's emerging science that suggests that what's really happening, as Chris said, is this inflammation of axons and diffuse swelling inciting an inflammatory response. And the inflammatory response also may involve autoimmune issues, and therefore that may be one of the genetic things that separates out this group that goes on to CTE from other groups. We don't know that today. These are theories, but these are things that really need to be better understood and better followed. And all I'm simply saying is largely through as I said, Chris bringing this into the public awareness, we're aware of these issues. We're frighteningly aware of the incidence of this being much higher than we ever could have dreamed. These brains that we've studied, almost every one of which have CTE, were all very symptomatic individuals. That's why they, in most cases, almost every case, died. That's why they came to our attention. So we're seeing a very skewed sample. But we don't really have a good idea for what the prevalence and incidence of this problem is out there. And as Chris has heard me say a million times, we want to study every brain that comes our way, and Ann McKee will do a crackerjack job, she and her other neuropathologists that now work under her and her technicians in studying this issue. But the brains I really want us to be looking at are the brains of the Wayne Gretzkys of the world, the brains of the athletes that played these sports who didn't take a lot of brain trauma during their period of playing the sport, who went on to very successful executive lives later and had no symptoms. And then many decades from now, I'm not trying to hurry anything up, Wayne, but when they die, look at those brains. Because if those brains show CTE, we got a problem. It's a little different than what we think it is. So we really need that information. And right now, as you can understand, when somebody has had a family member, a wife, or someone in their family die of some tragic issue, some personality change, some totally different person, they desperately want an answer. They're very much willing, in many cases, put Chris on them, they're definitely going to donate the brain. Somebody lives a normal life, has no problem, it's really a hard sell. Would you donate your brain, spinal cord, and eyes for study, please? And yet that's the group we desperately need.
Although, we are getting those brains. I chase every brain, and so I know these 94 cases more intimately. There are people like Kelly McGregor, who played a few weeks in the NFL, 48 years old when he died of a heart virus, president of the Colorado Rockies, so a very successful executive who had the disease. And there are others like that. So, when we pursue them blind. We say, we don't care what you died of, we want to take a look. But they are certainly more likely to give if they, showed a symptom. But certainly there are a lot of people who didn't. And a lot of people swore up and down that we wouldn't find anything.
If I can steal a question, you've connected CTE to concussions pretty strongly. No. Well, you've talked about concussions and
Yeah.
the potential relationship with CTE. What I'm wondering is, what about subconcussive hits? Is that something that you think also might potentially lead to CTE? The linemen who aren't getting, speared in the head by the defensive back, but are constantly, having these perhaps smaller impacts to their head more frequently.
Absolutely. Chris showed you the picture of Owen Thomas up there, the Penn football captain who had CTE, incipient CTE. He had, as Chris told you, he had no recognized concussions in his entire life. Did he really have no concussions? No, I don't believe that for a minute, but he had none that were recognized. It's total brain trauma that seems to be most responsible for CTE, and as Chris showed you, therefore, all those thousands of subconcussive blows, these 20G blows aren't causing concussions, but they're causing a violent shaking of the brain inside the skull. And it appears that total brain trauma is much more the important thing than just concussions. We find that in football, it's the linemen, offensive and defensive, and linebackers and D-backs. It's not the quarterbacks, wide receivers primarily that we see. In the NHL, it's primarily, he showed you Fleming, he showed you Probert. Those guys fought over 400 times. In the enforcers I see in my office, about 1 every 4 times or 5 times they fight, they have a concussion. No, they don't tell me they have a concussion. But when I ask them, have you had one of these 26 symptoms, we go through the checklist. Oh yeah, I had that about 1 every 4th or 5th fight. They go back to the penalty box, they do their 5 minutes, they never tell the medical staff they've had these symptoms because they realize their job in the NHL is fighting. They wouldn't have a job if they didn't fight. And there are a lot of people in the American Hockey League that are only too happy to go up and fight. So to protect their job, they never admit they have concussion symptoms and they're back out the next night.
Up here?
Having just had a 6th concussion myself, what is the best thing to do short-term and long-term to aid recovery? And also, at what point should I and other concussion sufferers start to worry about lingering symptoms and onset of later symptoms?
Well, first of all, welcome to the club. It's a very elite group. Go ahead. I'm just going to make jokes up here, and you tell them what they need to know.
No. Well, I think the most important thing is if you've had 6 concussions, as a doc, I'd want to know what sport you played. Is that a sport at high risk for a lot of subconcussive blows, or did each time you get a pretty significant blow, did it wind up with a concussion? I'd want to know how close they were together. I'd want to know how severe the previous ones were, how long did they last. If you've had some before that lasted 6 months with symptoms, I think we need a really serious discussion. If on the other hand, your others cleared up very quickly, that's not quite the same category. So the most important thing is ratcheting back your physical activity now, ratcheting back your cognitive activities to a level that doesn't aggravate symptoms. In an ideal world, you wouldn't be doing any cognitive activities, but this isn't an ideal world, so we do what we can, and then if we're not making gains that way, then we do have to pull people out of school. But the number of concussions, there isn't anything magical. Some people, 1 concussion is all they should ever get. And these are kids, and we've had them, where their symptoms may last. I think of Willie Brunn, the young Pop Warner football player. He actually had 2 concussions. He had his second one while still symptomatic from his first, but they were close together within 2 weeks. His dad was the coach and didn't know about concussions. And Willie couldn't remember the names of his classmates. He lost almost all his vocabulary and darn near all his math for about 6 months. And then it was June of the following year, after basically losing the school year, that stuff started to come back. We never let him go back to collision sports after having the severity of that injury. He did ultimately go back to non-collision sports.
I think maybe two more questions, and let's go back here.
I'd just like to say thank you, Dr. Cantu and Chris, for your work. We were at a little midget football game a couple weeks ago. Some little guy went down because he got hit in the head. It looked like the coach was going to say, "Get out of here, you're not hurt," right? But a mother ran from the sideline and said, "No, he can't play. He shouldn't play the rest of the day." So without the kind of work you're doing, I'm sure that mother would have not known what to do. My question is, just the money that's involved in football, right? The Big East, the ACC, billion-dollar contracts for college football. Can money help solve this problem? Can research and development in terms of equipment technology, can that be a way to help mitigate the damage that's being done?
You start, Chris.
I'll say yes, and you know where we can get some. The answer is yeah. I mean, this is absolutely a problem that TBI. I'm on the board of the Brain Injury Association of America. TBI is the most ridiculously underfunded area of research compared to others. You know, in fact, it affects more people than just about everything. 1.5 million people suffer real traumatic brain injuries every year outside of the 4 million concussions. So, you know, there's been very little money put forward to long-term research, treatment, diagnosis. I mean, you think about sideline diagnosis in 2011, and it's a 20-minute question and answer thing that has not even really been scientifically validated. It's not a scan, it's not a test, it's not anything. So, yes, there's absolutely needs to be more in research, absolutely needs to be more in technology. You know, helmets will get better, everything will get better. Luckily, at this point in time, all the best fixes are free. It's really all education that they can really get us to a dramatically safer spot. But beyond that, we will need to have a much more significant investment if we want to really feel safe about these things.
Talking about helmets, let me just take a second to put on the Noxie hat as vice president and say that helmets do a marvelous job at protecting against skull fracture, and very good, not as marvelous as skull fracture, but very good job protecting against subdural hematomas. They do a good job of attenuating the forces that are linear or translational, straight ahead, straight sideways. They don't do a good job of dampening or attenuating rotational forces. And it's the rotational forces that are felt to be most injurious to the brain in concussion, and for that matter, subdural hematoma. The forces that not only cause the brain to move, but the brain spins, and so you stretch greater. Because the head's elliptical shape, because helmets are elliptical shape, that's good because you glance off a lot with blows, but it's bad in the sense that it gives rise to a lot of rotational force. Helmets don't protect well against that, and probably for that reason will never be the answer. We got to keep working, we got to keep them better, and on, and I'm totally for it. While I'm on my soapbox, 30 seconds more. Female lacrosse. The concussions in female lacrosse happen because the sticks hit your head, not because heads collide, not because knees hit heads, almost exclusively. So a helmet does prevent those blunt linear forces like a stick hitting your head. And if you put helmets on female lacrosse players, you would prevent almost all concussion in lacrosse. And I hope that we will see in the next few years, although the governing body right now is resisting it because they're concerned about the sport turning more violent. I think we do need to have helmets on female lacrosse players, and I think we'll see it soon.
At dinner, we were talking about the value of, or lack of value, in wearing helmets during practices that might be intended to reduce injuries, that is, practices without pads. Could you share your thoughts on the benefit of that?
Well, Kev Guskowitz down at University of North Carolina, who recently received the MacArthur scholarship, has done a study which it really speaks for UNC. It's really not a study that I've seen replicated a lot of places, but it does make sense. And what he basically found was that when the individuals, the players on the football team, were doing those drills and those practices on days with helmets only, no shoulder pads, they still collided heads all the time. They still hit with their head. In fact, they couldn't hit with their shoulders, so they tended to use their head more. Chris should comment on this because he's played the sport through his all Ivy career at Harvard. But that would lead you to believe that you really need to have helmetless practices if you want to take hitting of the head out of those practices. And so totally going without pads, totally going without headgear is important. And just taking off the shoulder pads, as long as the helmet's on, is not going to do it. But Chris, you lived it.
Yeah, good times. Yeah, well, you know, Bob's, and that's that. When we've had our first NFL Player Association meeting, that was the data I showed. That, you know, this idea that you're safer with helmets only. You know, I was part of the Ivy League concussion committee that went, you know, reevaluated this issue a few months ago, and what they decided to do was limit. You know, the NCAA allows 5 full contact practices per week, full pads, and they said we're going to limit it to 2. And I pointed out that research, and I said, but that's not going to make anyone's brain any safer according to the research. But they thought, not to speak badly of the Ivy League, but I really was disappointed that they thought that would fly. And they did fool America to think that they made football safer, but the reality is they did not, under any circumstances, make those players safer. And that bothered me. So the choice is you either take the helmets off, or you really educate these coaches and provide them alternatives for what to do within practice to teach the game that don't involve heads colliding. And that's really a lot what we're working on, offering both alternatives, both trying to teach, especially as you move down, youth coaches, to focus on developing skills like endurance and strength and speed and change of direction and understanding the game that don't involve heads colliding, whether you have the shoulder pads and helmets on or not.
As we were telling the NESCAC group this afternoon, the winningest college football coach in this country, John Gagliardi, Collegeville, Minnesota, St. John University, doesn't have any full hitting, full contact, tackling once the season starts. It's reserved for game day, and he is the winningest coach in the country.
One last question. Yes, back there.
Yes, sir. The military in recent years has had a major problem with this kind of problem, situation. Are you connected with some of the research that they are doing?
With whom, sir?
The military.
Yeah, we've served on a couple of committees that put together algorithms for assessing head injuries on the front, which are largely neuropsychological tests that are done. But I'm not directly connected with the military. Ann McKee of our group works within the VA hospital system and has funding in the VA hospital system, and we hope very soon we'll have Department of Defense funding for the research that's being carried out in her facility.
And we also do have the brains of 14 veterans in the
with
brain bank.
CTE.
So.
Thank you all for coming, and thank you particularly Chris Nowinski and Robert Cantu for coming and helping raise awareness in our community. Thank you, and have a wonderful night.